Hello, welcome to the Healthy Alternatives podcast. I am Dr. Christine Sauer with DocChristine.com. Today's show is a recording of my radio show of the same name. Enjoy! Good afternoon, this is Dr. Christine Sauer, your host of the show Healthy Alternatives here on 97.5 CIOE FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare, and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well, so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you, don't give up. There's a light at the end of the tunnel for you too. Today, I'm extremely pleased to be with Dr. Diana Lee. She is best introducing herself because she is such an illustrious person. I really want to give you the opportunity to introduce yourself. Thank you so much for joining me today.
Thank you for inviting me. My name is Diana Lee. I'm doctor in China. I'm MD in China. So after medical school, and deeply fall in love with acupuncture and traditional Chinese medicine. So I continue my training, master degree in acupuncture, traditional Chinese medicine, and then continue training in PhD degree in acupuncture and the traditional Chinese medicine. Wow. So I do acupuncture, traditional Chinese medicine, past 30 years now, and it's my passion, and I really love the job I do.
That is amazing. Now, we know that you are born in China. Tell us a little bit about where in China you were born, so our listeners have a little idea of it, and how you ended up here in Canada in Halifax.
Yeah, well, first of all, I want to say why I'm getting into acupuncture. Because when I'm 13 years old, I have rheumatoid arthritis, and I cannot take a medication. So my mom bring me to see an acupuncture doctor. And with acupuncture, I'm healed 100%. So that's why I'm falling in love with acupuncture, traditional Chinese medicine. And so even in beginning of a medical school, I aim for become acupuncture and traditional Chinese medicine. And after graduate, I work in the hospital to helping a lot of patients use acupuncture and traditional Chinese medicine, then go to the master degree for acupuncture, traditional Chinese medicine. Then I follow my husband from China, come over to Canada. And so this, which is 30 years ago. And I really enjoy Canada. Very friendly people, and really big change. I saw traditional Chinese medicine and acupuncture in especially maritime, because I see the change from very beginning. No people know acupuncture. We are the first acupuncture clinic, and in New Brunswick and in Nova Scotia. Right now, we set up an acupuncture traditional Chinese medicine school called Canadian College of Acupuncture Traditional Chinese Medicine. We saw many practitioners that set up the acupuncture clinic. Besides our students, our graduates, also other people move from from big city come to Nova Scotia to set up the acupuncture traditional Chinese medicine clinic, which is amazing.
It is amazing, and I have the deepest respect for the Chinese tradition, where acupuncture was founded 5,000 years ago, when in Europe they were still bloodletting and doing all kinds of hocus pocus. It already worked for Chinese people, even though they didn't have the sophisticated needles like now, but they knew their herbs, they knew their points. And whether you believe in the spiritual system behind it or not, it does work. And you probably know better than I. Does it work in animals too?
Yes, they have a working for dog and a cat. Yeah. I have a dog and a cat at home, so I do put the needle in them, so they relaxing them. For example, sometimes dog have a sneeze, catch a cold, have a sick stomach. I choose a certain acupuncture points, working on them. They're amazing. They respond extremely well.
Yeah.
Also, like a patient always wonder, or people wonder, is that acupuncture all in your mind, or they actually working? Or you always see, for animal, they don't have a mind. Not mean don't have a mind, don't have a mindset before. See, they're working.
You can't tell them that it will work. Like a person might believe in it, what they call the placebo effect.
Exactly.
But if it works in animals, even a skeptical Western medicine doctor needs to believe that acupuncture actually works. And I heard, is it true that they do anesthesia just with acupuncture in China?
Yeah, they do in China, working on, in the hospital. Mm-hmm. And they working, this is one of the reasons why acupuncture from China go to American for, because this on the 1970s. They go to China, see they're actually working. They introduce getting popular in American and slowly into Canada.
And I wish it would be actually used in hospitals. Even if it doesn't work completely, they can reduce the amount of anesthetics they would need for surgeries if they used that acupuncture and in addition, wouldn't it?
Yeah, more than just for surgery. Also, for example, acupuncture really good for a lot of other illness. For example, for stroke. Stroke patient very, very beginning into the early stage of healing process. In China, the connecting with acupuncture department combined together to helping stroke patient recovery is excellent results. Also, we are treating a lot of, for example, in our clinic, we're treating a lot of infertility patient, which is my favorite. Me and Dr. Franklin Chen, we put 22 years of time energy become acupuncture and TCM gynecology to helping patient with the infertility, working on women's issue. And we have 446 baby as a result come from the treatment, which this is really, really amazing. They are from beginning to later. You have a result holding your arm or make your heart just singing. It's one of a wonderful feeling, which this is truly showing results because you have a baby there.
It's an amazing result, and you can achieve it without hormones and artificial medications. It's just to regulate the body's systems in a better way.
Exactly. We are, for example, our infertility patient, we have a 50% of patient just use traditional Chinese medicine, herbal medicine, naturally healing themselves, then have a pregnancy. Most of the patients come to us have 1 or 2 years and infertility history. Then we're helping them. They try out Western medicine. They're not working. They come to us. Of course, we still have 30-40% of patients combine acupuncture with IVF, which medical research is showing acupuncture can increase IVF successful rates 30-40%. So we're working together with a Western medicine doctor, gynecology, make this success.
And I think that's really the future of acupuncture and traditional Chinese medicine, to get fused with the Western medicine and the Eastern, because they both have their benefits, big time benefits.
Exactly. We have me and Dr. Chen's patient, 50% of patients referred by family physician or specialist. So I know a lot of doctors, the specialists, very open mind. So they're getting better and better. This is why we set up a Canadian College Acupuncture traditional Chinese medicine school to train more and more qualified practitioner, helping our community getting healthier, getting better.
Yeah, and it is certainly a very complicated set of rules and points that you need to learn to actually be able to do successfully acupuncture and TCM.
Yes, our pro, like the Canadian College of Acupuncture Traditional Chinese Medicine, they have a 3 years program. You can fast track in 2 years. And the student from some is MD, from hospital come to the school. Some is the nurse, some is the massage therapist, and some of them, is just retire, want to change their career, or they want to helping people. And some from high school go in. So you have different age. The purpose of the student is want to helping people. They have the passion, love, and, dream to helping people. That in them, they are truly healer. So they are want to helping people, make them very successful. Our graduate open clinic over in Canada, and they are really successful practitioner helping thousands of patients.
Now, who would be a typical patient that comes to you? Probably a complicated case.
Our patients have from children very young age, few weeks old, and to oldest than 98 years old. So you have a patient across all the age group. And for children, a lot of asthma, ADD, ADHD patient. And so children respond for acupuncture very quick. And, to middle age, digestive system issue, irritable bowel syndrome, asthma, allergy, and to, like a menopause and arthritis, pain condition, all kind of different other illness.
Yeah, I think acupuncture in the Western world is mostly known for its ability to influence pain. And I remember I used to have chronic back pain, and I was in the pain clinic program, and the pain clinic didn't even have an acupuncturist in their program, neither a chiropractor. And I thought both of them would have been such a big asset. I think now they have somebody. I'm not quite sure.
Yeah, I think you are right. For acupuncture relieve pain, actually scientific proof working extremely good. One of the very best way to relieve pain. And I think right now all the doctors have an open mind. A lot of chiropractors hire acupuncturists because I do know they hire from our graduates come to working for them. Pain clinic, and I think someone working on there too. I'm not 100% sure, but I believe all the doctors have an open mind. For pain relief, all doctors know. For example, in our clinic, we specialize, we go to international conference. One of our research paper specialize on using acupuncture treating whiplash patient.
Wow.
Yeah. And they prove to have excellent results.
That is amazing. And I think in the second half of our show, we'll talk a little bit more about that exciting effects of acupuncture in Chinese medicine. And this brings us to the end of the first half of today's broadcast. Please tune in after the commercial break for more about acupuncture, traditional Chinese medicine with Dr. Li.
Thank you.
Hello and welcome back to Healthy Alternatives here on 97.5 CIOE FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I'm very pleased to be talking to Dr. Diana Li. And in the break, I looked at her credentials, and it is amazing. Her card is so small, printed with all the titles she has. She is a very smart and learned woman and a very kind and friendly lady on top of it, which is just as important in my books. And she's not only the president of the Chinese Medicine and Acupuncture Association of Canada, the Nova Scotia chapter, but also the executive committee board member of the World Federation of Acupuncture Societies. Wow. So she is a very smart lady, and we were talking in the third half a little bit about acupuncture and traditional Chinese medicine and how it helps many people with many illnesses. Now, what's the belief system behind it? I know you were born and raised in China, so many people have not a very clear idea how old really the Chinese culture is.
Chinese medicine have 5,000 years of history. And they are mostly different with the Western medicine. There is their holism. So they view patient or treating patient with the mind and the body. For example, in traditional Chinese medicine, they believe on a 5-element theory. And each element, they have a yin organ, yang organ, connecting with the emotion, connecting with the muscle, ligaments, bone, different, a body system. And, when you have an illness, your internal disorder can affect an external condition, external pain or soreness, muscle aching pain, maybe either because the internal organ disorder of balance. Yeah,
I love that idea, and it is really what we now come more and more to believe in the Western, especially the naturopathic and combined functional medicine tradition. It's all influences each other. And the Chinese discovered that years ago and never lost that belief, because early Western medicine had that belief too, but just never so elaborate and so consequent as the Chinese.
Yes, the Chinese medicine mostly, I think, become the best practitioner of acupuncture or traditional Chinese medicine. Your number one is your diagnosis skill. You how to view the human body. This internal condition, how to affecting external or external pain. You just don't think in the muscle, ligaments, or joint pain. You look into certain internal organ disorder of balance, hold the patient as a whole, not just treating patient part right. of the condition. That is one of the most important for traditional Chinese medicine, mean diagnose. You diagnose right, you design a personalized treatment program, then you are success half.
It's half of
already.
Success, yeah. And that is often neglected in Western medicine. They just look at the symptom and then smash it with some medicine. And that's not good. And I completely agree. And my assessments are very thorough too. But how does a Chinese traditional assessment or diagnosis look like?
Traditional Chinese medicine actually is a completely medical system. They are different than Western medicine. Doesn't matter from a diagnosis point of view or treatment point of view. So because they are total different medical system, you have to training from beginning, from the yin-yang theory, 5-element theory, diagnosis theory. You have to go completely into training with the meridians, with the internal organ, with the China TCM diagnose, TCM treatment principle. So you have to training on that part. This is why acupuncture, you cannot go to short, quick course. And you need really diving in to understanding the system completely before can give the best possible results.
Now, tell us a little bit about the theory behind Qi and Yin and Yang, because many people know about it, but don't really know what it is. I myself do Tai Chi and I feel the energy flowing. It's beautiful, but I don't know much about the theory behind it.
Oh, they believe the Qi, like energy flow. Mm-hmm. They think a human body made from a 12 regular meridian. Each meridian relate with a different internal organ. For example, on your arm, have a 6 meridian. They have a heart meridian, heart protector meridian, lung meridian, opposite relate with the large intensive meridian, 3 jaw meridian, small intensive meridian. So if you have a shoulder pain or arm pain, you're not just thinking about is a frozen shoulder or tendinitis. You want to think about, they have any internal condition? For example, they have a certain internal inside the arm pain. They will thinking, you have any heart condition or some anxiety. So they view the energy blockage, qi blockage in that area indicate a certain internal disorder. So there's one of them there. For yin and the yang, they're thinking about can be bigger, can be small. Like a female is the yin, male is the yang. And your internal is the yin, Actional is yang. Certain organ is the yin organ, certain organ the yang organ. In one organ, certain function is the yin function, certain function is the yang function. So they can go very, very deep to use a way to diagnose a helping patient.
Wow, that is really fascinating. So it's a whole science behind it that the Chinese developed over 5,000 years. It's one of the oldest systems really that's known in medicine.
Yes, for example, like for thousands of years, they developing not only their own completely different way to TCM diagnose, also into the treatment, they total different. We have a lot of acupuncturists. They think acupuncture is, just do acupuncture. This acupuncture not just put the needle into the patient. The acupuncture have a special technique. As acupuncturist, good acupuncturist, acupuncture doctor, you use your own energy, the qi, to stimulate patient's energy and the qi, stimulate different internal organs meridians to treating internal organ disease. So one good success practitioner is diagnosed. Second successful skill is have an acupuncture technique. So not just put the needle in, walk away. This is not just as simple like that.
And I know from when I was 16, I was I studied medicine all over and I studied a book about acupuncture. So now at 16, of course, teenager, I want to try it. So I sterilized some pincushion needles and tried it. It hurt, so I didn't do it. But it was interesting because I learned from the book, and I want to ask you if that's still the case, that when you have an acupuncture needle, you can feel if it's in the right spot yourself because you can feel the energy like an electricity and it gets red afterwards.
Acupuncture, when you put the needle in, the very thin, small, tiny needle and like a hair thin needle, when you put the needle in, the needle not painful at
not
all.
Anymore. Yeah, not anymore.
Not anymore.
And that's important to say. They're not anymore painful. They were years ago, no longer.
Yeah, so the technique getting better, needle getting quality getting better. But depend on which practitioner you go to see, the different skill, the technique, skill, the energy, many years of clinic make their function different. Like acupuncture, the results are different. Some patients say, I try acupuncture before, they're now working. We often see where you try your acupuncture, what the practitioner you saw, because they do working. If you diagnose right, you use the right technique. So like acupuncture, you do need really, really study well before can become best acupuncturist.
So that's important. It's not really an area where you read a book and then try it out. It doesn't work. You have to learn it from a master like yourself.
Yeah, that's why we thinking about to helping people learning acupuncture well. That's why the Canadian College of Acupuncture and the same college is set up in Bedford Highway. We focus on the maritime and helping and training good practitioner to helping community.
And that is wonderful. And let me just share your website for anybody that's interested in studying at the Canadian College of Acupuncture and Traditional Chinese Medicine under Dr. Diana Lee. The website is www.ccatcm.ca, or you can look at, acupunctureNS.ca. And they actually have a very easy email to remember, which is acup@eastlink.ca, which many will recognize. And I recommend, if you're interested in that, connect with the college. And there's amazing people like Dr. Lee learning and studying about it. Now, it was a real big pleasure to have you on the show today. Thank you very much for coming up.
Thank you for inviting me.
And this brings us to the end of today's show. Please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you'd like to contact Dr. Lee or the Acupuncture College, you can either email them or look them up. It's the Canadian College of Acupuncture and Traditional Chinese Medicine in the Bedford Highway here in Halifax, Bedford. And my email here, if you have any questions, is christine@communityradio.ca, or you can contact me through my website, which is docchristine.com. I'm always grateful for any feedback, and I also want to extend a special thank you to today's producer, Seth Glasgow. Thanks, young man. You might not know this, but this is a volunteer-run, non-profit radio station, and we even have an art gallery. If you're local and you'd like to drop in, we're at 11 Glendale Avenue, Lower Sackville. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE FM Community Radio, with live stream at communityradio.ca for the next episode. Goodbye and have a great day.